Welcome back to Everyday Kentucky. I'm Madison Bowling. Today I'm with two bariatric doctors, Dr. Eric Smith and Dr. Sarah Hayek, to talk about the Kentucky Bariatric Institute that is affiliated with Georgetown Community Hospital. Thank you all so much for coming here today.
Yeah, thanks for having us.
Anytime. So, Dr. Smith, you look familiar. Can you tell us, most people, you're used to these bright lights and being on the screen. Can you tell us, where people may have seen you other than your office?
Sure. Well, they've probably seen me in the community from being a part of the practice for some time, but obviously I'm also part of TLC's 1,000-Pound Sisters and in the bariatric surgeons, for the family there that they feature on the show.
Oh, I love it. And Dr. Hayek, please tell me, you're new to Kentucky and you're new to KBI. Tell us how you made it here and what made you want to come here.
Absolutely. So yeah, new to Kentucky, new to KBI. Came here a couple months ago and really came here to work with Dr. Smith. We've worked together for a little bit on robotic surgery and decided to come out here and join his practice, and specializing in bariatric surgery and robotic surgery.
And we are talking about bariatric surgery. Can you tell our audience what is bariatric surgery for people that don't know what it is?
Sure, I'll let you do that.
Sure. So bariatric surgery is a great option for some patients in order to treat obesity and obesity-related diseases.
Oh, so typically, how long does the surgery last? Do you go through a certain process to be approved for it? I know there's different things for different surgeries, but this one, there's some things to go through.
So bariatric surgery, or many people call it weight loss surgery, there are definitely indications of when that surgery would be applicable. I think that the public does not oftentimes recognize obesity as a disease, and it is a disease. It's recognized as a disease, and it's just like treating any other disease, whether you would treat medications for high blood pressure or surgery for other pathology. These surgeries can be very effective for people who battle with obesity, and the outcomes from these surgeries and the success of these surgeries is far superior to anything else that we have currently for people who battle with being overweight. Something as simple as just diet and exercise alone for a patient who battles with obesity has a chance to work long term of no greater than 1%. And we're talking about what we do that's much higher, where we're talking about at 5 years out, 50% of these people are not even obese anymore, and 80 to 85% of these people have lost significant amount of weight, or their outcomes are improved compared to where they were before surgery.
Oh my goodness! So it's a great internal tool to help those who are battling.
Absolutely. And part of bariatric surgery is not just doing the surgery. It's with our program where we have dietitians and bariatric nurses and in-house psychology. It is a lifestyle change. And so we want to make sure patients have all those tools in place in conjunction with the surgery to make sure that this lasts forever.
Well, so how can people find you all and your office and possibly get that ball rolling to be a candidate for bariatric surgery?
Sure.
Absolutely. So it's Kentucky Bariatric Institute, and many people come to us through speaking with their primary care physicians first, and they can send a referral over to us, and we can absolutely assist them with that. You can also find us by doing an internet search and submitting a form online, and we will contact you. So you don't necessarily need to go through your primary care physician. Simple internet search or give us a phone call.
Well, that sounds like a super simple, just, hey, give us a call, and you can get the ball rolling for that, to help combat obesity.
Sure, absolutely.
Thank you all so much for joining us today. We appreciate you all.
Yeah, thanks for having us.